It's Wednesday. Welcome to our Wednesday Wellness Tip. For today's physical tip, I'd like to share with you about a test that we've done the last couple years called GenetWorks. Now this is a genetic test, and I love doing this test because what it includes are 33 different genetic pathways or genes. Now let me explain that. So, as we've become more sophisticated in pharmacology, we realize that people have different genetics in how they metabolize some of the medications. A lot of this research came through the psychiatry world because, as you know, there are multitudes of medications that can be used as antidepressants, anti-anxiety medications, and many of them have several side effects. And unfortunately, it takes being on those medications sometimes 2 and 3, 4 weeks before you can tell if a medication is going to be helpful or not. And so knowing your genetic pathways and how you metabolize medications can create a huge shortcut in that process, because then medications can be used that are in the patient's normal metabolism sequence. So this test is very comprehensive because first what they will do is take any medications that you're on and then show you if this is good for your genetics or if an alternative medication should be recommended. And then they go through all 33 different pathways and they explain what that pathway involves, what are the common medications that are metabolized in that pathway, and what some of the precautions are. So what I love about it is that it does include the APOE, which of course is the gene that shows how you metabolize cholesterol, which is very important because, as you've heard me say before, from that information, then we can give people a specific diet for their genetics. And so when you follow a nutrition plan based on the diet for your genetics, it's like turning the inflammation switch off. It also includes the gene that's called the MTHFR. And this particular gene is involved in how you metabolize B vitamins. And people who have either 1 or 2 variants in this gene have a very difficult time absorbing B vitamins. And there are several issues that are associated with people who have a single or double MTHFR variation. For instance, infertility issues are commonly associated with the MTHFR variation. Even some birth defects such as a cleft palate. So this is very helpful to know if you have this particular gene. What we do about it is if you do have a variation in the MTHFR is to make sure that you're taking vitamins that have the methylated B vitamins. Because if you have that gene variation, you absolutely need the methylated vitamins, which takes off one step in that processing of the B vitamin metabolism so that you can absorb it easier. So all of the vitamins that we use here are the methylated forms, just in case someone has an MTHFR variation and doesn't know about it. So finally, the beauty of this test is that you have this for life. And this information will be very helpful and important as you age and maybe might need a medication. So they take every grouping of medications, such as psychiatry, they show you what pathways, what medications are in the normal pathways that you metabolize. They also show you medications that you would need to use with caution because of how you genetically metabolize those drugs. And finally, they show you the red category And this means medications that you should not use, and they should think of another option. They go through pain medications, same thing, to show you what's good for your genetic pathway. They go through all the medications that are used in cardiology, so blood pressure medications, all of those. And again, what is beneficial and what medications should be used with caution or not at all. Anesthesia agents, any medications that are used in endocrinology, gastroenterology, immunology, infectious disease, and neurology. So you can see how beneficial this test might be. Even oncology, pulmonology, every drug classification you can think of. And now they've even added an other category, which includes some over-the-counter things. So very comprehensive and can really be advantageous if you have to go on a prescription medication and you're worried about potential side effects. Then this at least shows you what medications could be safer for you. So the test, of course, most insurance companies are not covering this at this point. I expect in a few years they will. But right now, if you do the cash rate, it's $300. But it's a wealth of information that's going to last the rest of your life. So that's our physical tip for today.